Hi, I'm Dr. Jomaa, the sports med specialist, and today's quick clinical bite is on femoral neck stress fractures. So I had a 33-year-old military recruit come and see me today with a right-sided hip pain that was caused by a compression-sided stress fracture. These injuries are usually the result of repetitive stress, and they're often seen in athletes or those with a sudden spike in training load. So let's have a quick look at his stress injury. On these MRI images, fluid is white, and you can see on the inner part or the medial part of the hip at the neck of the femur, there's a significant amount of swelling here, and this is where the bone stress has occurred. This is known as a compressive stress injury, and this area tolerates compressive forces much better than tensile forces, and so it's a good candidate for non-surgical management. When the bone stress occurs on the tension side or the lateral side of the femoral neck, then prognosis for non-surgical management isn't as good, and usually an urgent surgical intervention is needed. So with this patient, we started him off with a month of complete non-weight bearing in crutches, and then another 2 weeks after that of touch weight bearing. He's been gradually progressing his loads since then, and we're up to the stage now of being able to walk 3 kilometers without any pain. Sometimes your doctor might choose to do a few extra tests to check in on your bone health if they're concerned that maybe a stress injury is out of proportion to how much load you've been putting through it or the spike in your training load. That was the case for this patient, and I did send him away for some blood tests, but thankfully his bone health markers and his hormone markers were all quite normal. He was quite low in his vitamin D, but we've started supplementing that. Also good news is that his DEXA bone density scan didn't show any significant osteopenia or osteoporosis. So the next step from today is a structured walk to run program, which we've just kicked off with him, and he should be back to full sprinting in around 6 to 8 weeks. See you next time.